I'm Michael Bloom, chiropractor. One of the things that commonly happens in practice is people come in with soreness in their mid-back extending into their ribs. Now, often that can be after an incident such as a little slip or a twist that your body is not prepared for. So what's actually happening when that occurs? So the ribs, the 12 ribs are attached at the back to the spine and then they wrap around, and some of them attach into the sternum and some lower down hang free. But essentially the ribs are very susceptible to sudden twists and rotations. So picture this, you're walking along, you stand on a slippery object, you're not prepared for it, and suddenly your body is jerked into a twist. So what's actually happening in that case? In most cases, that causes a strain, a sudden strain in either the rib joints, so where the bone of the rib is attaching into the spine, and or a strain of the muscles between the ribs known as the intercostal muscles. Either way, it's painful. And the thing about the rib strains or the rib sprains is it can be really debilitating. It can affect you when you're sleeping because you're lying on the ribs. It certainly can affect you if you take deep breaths because of the expansion of the rib cage. And the other thing is you can't do a lot about it. You can't, plaster up an injury. You really can't do a whole lot. You just have to actually deal with it. You have to actually just know that this could be a 4 to 8 week period of time where you're always going to be reminded, oh, the ribs, something's wrong with the ribs. Because every time we take a breath, the ribs are subtly moving, so they don't get a really good rest. So they don't get the opportunity to heal quite as quickly as if you could fully immobilize an area of the body that had had some traumatic sprain. So they take a while to get better. They do get better, but they can be really painful in the meantime. So that's just a little bit of information for those that are dealing with it. And then maybe you're in the middle of an episode with a lot of chest pain, rib pain as a result. And you're thinking, when's this ever going to get better? Is this going to get better? What can I do to make it better? Well, to a large degree, if it's really bad, you may get an x-ray to just check if the rib was cracked or broken. But even then, there's not a great deal that can be done about it. It's really just a case of gradually and steadily, the human body being the amazing structure that it is, will heal, but it just takes time and often weeks into months. So that's just a bit of information in case you're going through it or you've been through it, or in the future you do go through it. But realize you will get better, but it takes a little bit of time. And in the meantime, you want to avoid twisting. You want to avoid a lot of pressure on the area that is really sore. And you want to avoid having to take lots of deep, expansive breaths, which really stretch that rib area. It can be very painful, particularly on the deep breath in. So I hope this information's been useful to you, and it may be reassuring to you that if you're dealing with something like this, it will get better. Wherever you are, have a great day. Hope you're healthy and well. If there are any questions, please just pop them in and I'll get back to you as soon as I possibly can. Thanks for watching.